Hi everyone, my name's Amy Dickson. I'd like to welcome you back to my series of videos about breathing, which aim to teach you how to breathe in an optimal way. Quite often when we're upset, some very kind-hearted person will tell us to just take a deep breath. However, a deep breath, in the way that many people interpret it, may not be all that helpful for two reasons. A lot of people, when they take a deep breath, do this. They breathe into their chest, they raise their shoulders, and they purse their nostrils. However, the way we should breathe when we're doing relaxed breathing is to take a gentle breath in through the nose to direct it all the way to the diaphragm, avoiding the upper chest, and then pause, and then take a longer breath out through the mouth, and then pause again. The other problem is this: when we breathe a deep breath in, quite often we follow it with a fairly vigorous exhalation. And so we end up breathing out too much carbon dioxide, with the effect that levels of carbon dioxide in the body drop. This actually reduces the amount of oxygen that's delivered to our cells, because our bodies require a certain amount of carbon dioxide to be present in our systems for cellular absorption of oxygen. So what we end up doing is actually starving our bodies of oxygen, which is pretty much the opposite of what we intended to do in the first place. The only benefit that comes from breathing in this way is that by default we end up slowing our breathing down. But of course that could be achieved without having to take a deep breath. Here's Gerry to tell us a little bit more about it. So you and I are both very big believers in a technique which we call relaxed breathing. Would you mind telling us all what relaxed breathing is?
I'd be delighted to, for several reasons. So I think when you look at the popular press, articles in the Sunday magazine, breathing apps, so-called breathing gurus, I think one of the things that winds me up is this concept of deep breathing. And the problem with deep is it just means different things to different people. And so for some people, deep could mean I'm using my diaphragm. And if that's the case, and they're breathing down here, and that's what they believe deep breathing to be, that's great. In my experience, when I ask most people to show me their version of deep breathing, they start changing the volume. And the volume's a big problem, and volume is probably something that most people haven't quite considered. But when we look at people on a capnometer, and they're doing their so-called deep breathing, what we can see very, very quickly is they start blowing off their carbon dioxide. You probably remember in the old days at school, in your biology lessons, you were told, breathing's easy. Breathe in oxygen, breathe out CO2. Oxygen's the good guy, CO2's the bad guy. And like many things you learn at school, it's not true. So the science and physiology of breathing tells us that actually if the patient can't retain enough carbon dioxide, you can't actually release the oxygen you're breathing in through the air on a cellular level. And so the main purpose of breathing is getting oxygens into your cells. And the way we do that is we get oxygen from the air to our lungs, from the lungs to our blood. The blood carries it to the cell, and it can only exchange via a sort of pressure gradient. So if the patient has done a lot of deep breathing, as in the volume type stuff, they end up having low levels of CO2. So ironically, that actually compromises oxygen delivery. Okay. Second part of it really is the rate of breathing. A lot of people probably have a very fast breathing rate. The average UK breathing rate is about 14 cycles a minute. Whereas what we know is optimal relaxed breathing is between 6 and 8 cycles. So you're doing the maths, but it's correct. Most people in England probably breathe twice as fast as they need to breathe. And I see people breathing a lot faster. Okay? Now, the problem is you can't move somebody from, say, breathing 20 cycles a minute to suddenly 6. So a good analogy, and I'll often use with patients, and I say, well, if I wandered around like that for 25 years, and then I met some bloke at the health equation who says to me, Gerry, that's really interesting, but I think you might be better if your arm's down here. Now, my brain can do that, but as soon as I walk out of the door, I want to do this again. So the problem with behaviour is very entrenched. And I think the issue about rate, knowing most people breathe too fast, is we use a concept of what we call a pause. So what I would say to somebody is I want them to breathe in gently, pause, breathe out gently, and pause. And just try that for maybe 30 seconds or a minute. And the brain and muscles have to get used to coordinating together, and that's the key. And I think the other part of it really is about where people are breathing from. And we have this word, the diaphragm. So the diaphragm is the very large muscle. We call it the primary muscle of respiration. It's around the lower part of your rib cage. Goes all the way around to insert around your thoracolumbar junction, upper mid-lumbar spine. Sorry, those are anatomical terms to do with where they come from. It's like a dome, really. So what happens when you breathe in, the diaphragm is meant to flatten. As it flattens, it tends to push the abdominal contents a little bit and flare out the lower part of your rib cage. So another word is belly breathing, you've probably heard of. I do laugh occasionally because people sometimes think with belly breathing the air's going into the belly. That does not happen, I guarantee it. It's purely a displacement of the abdominal contents because of how the diaphragm is moving out, up and down. And then one of the other really interesting things is the ratio or the length of the in-breath in comparison to the out-breath. And we'll go on to explain that actually breathing in, which is an active response. So essentially it's part of the stress response. When you breathe in, your pulse rate goes up. And when you breathe out, it's a passive response. It's a relaxation response. It's controlled by the parasympathetic or the relaxation part of the nervous system. And so ironically for most patients, because their brains are so focused on, I need to breathe in oxygen, they've completely forgotten all the other parts about breathing, or possibly didn't even know it to start off with. But breathing is as much about breathing out as it is about breathing in. And for lots of people, that's a bit of a challenge in the beginning.
Thank you for joining us for this video. I hope you enjoyed it. And the next video is going to be all about nose and mouth breathing and the importance of trying to breathe primarily through the nose rather than the mouth. So I do hope that you can join us for that. Bye for now.